Good afternoon, Coronians. Thank you for joining us. I want to introduce everybody to our featured employee of the month. This month, we're working with Kayla Chancey, who is the operations manager for the company formerly known as PMG, which is now Coronis Health FQHC vertical. They are based in Providence, Rhode Island. And first of all, welcome, Kayla. Congratulations on being selected as the feature employee of the month. I do know that you've got 17 staff rolling up to you. The management team over there were very enthusiastically pointing out all the good deeds you've been doing. So if you wouldn't mind, tell us a little bit about how long you've been with the organization and your journey through the organization.
Sure. So in August, it will be 11 years that I've been with PMG, now Coronis. I started off, I actually went to Lincoln Technical Institute. So it's a local technical school in our state for medical billing and coding. And I had an externship at PMG for about 6 weeks. So I was there as an extern working on special projects, manually entering claims on a website. So I've had my hands on all types of things. And I was hired, which I was very grateful for, to be an account manager. So from there, I've worked in the IT department for about 1.5 years. That was fun, but I missed the billing side of things. So I went back to billing. I worked in the transition team for a little bit, working with new clients. So understanding the process when you sign with a new client and everything that needs to be done behind the scenes to get ready for that, for the new business. Then I went back to like a senior account manager role, and then I was a training manager for about 18 months, which I really enjoyed, and now most recently the operations manager role. So I think having gone through the ladder, so to speak, has helped me understand all the different pieces of everything in the entire revenue cycle. So
fantastic. What a journey. So yeah. What is today's operations manager role involved for you on a day-to-day basis?
So day-to-day, it's a mixture of overseeing employees, so my staff, in addition to the clients, and sort of being the middleman sometimes as well, taking a look at productivity, measures and goals. Are we where we need to be? And then also jumping in with some client requests. Is there anything that I can do to help, meet the client's needs, or a lot of training too. So our staff do a really great job, but being a training manager has made me realize what I really enjoy is working with people and seeing the light bulb go on. So I'd rather spend an hour with someone and look at a bunch of claims and say, all right, what's the problem? What are some steps that we can take to resolve the issue? And really seeing people grow and become more confident. So as an operations manager, that's really important to me.
Wow, great overview. And I'm starting to get a clue about when you're talking a lot about your training and the pleasure you take out of seeing things improve. I'm starting to get a clue to what the answer is to the next question. So since joining PMG, becoming part of Coronis, what changes have you noticed and how have you been involved in that?
So the biggest change would be obviously in addition to our offshore vendors. So we currently had 2 offshore vendors that we work with, and now with Coronis, we have actual Coronis Global, who we can work with as our fellow employees. So that's going to be a little bit different, and that obviously requires training as well. So in a sense, that's different. But as far as the revenue cycle and our day-to-day, that hasn't changed too much. There's some more expectations, which I would expect, but it's definitely, the training piece and getting a whole new group of people up to speed in the FQHC world, which we know is very, very different.
Right, and so how did you get involved in training the IHC group? I heard you volunteered, which is, you just said, we got to do this, or tell me what you've been doing with the guys at the IHC Center in Chandigarh.
Yeah, so we have weekly RCM manager meetings with myself, Kristen, Allison. There are our 2 directors, and Jeff, who's the VP. And, we talk about current needs and things that we need to tackle. And we try to divide things up based on everybody's strengths. And I know, having my training background, that why not apply everything that I built to new employees to this new group in India? And it's a very helpful program because you're not just throwing somebody into the claims, you're giving them an overview on FQHC billing. How do we work? You know, how do we process charges? How do we handle payments and all the fundamentals before they dive into the weeds, so to speak. So I kind of volunteered myself just because I know I've been through that before and I could easily apply that process to that group.
Fantastic. And at the end of that process, do you think there's going to be a significant advantage working with fellow Coronis team members in Chandigarh versus third-party vendors?
I do. I do think it's going to be better, but there will be hiccups at the beginning because everything is still new. Even though I've gone through the initial onboarding training with them, once they start diving into claims, you know, more questions come up. You're looking at the way something processed as an FQHC. It's totally different than a fee-for-service claim. So there's still going to be questions, but I think there's definitely a benefit, the fact that there are fellow coworkers, and it's not so much of a battle as, you know, looking at a contract and saying, well, you're not meeting this deadline, or, you know, it takes that stress away, I guess.
Right. There's a different stress, which is the collective expectation of making the client happy, but we're all pulling in the same direction. That's what I find in the other business groups I work with. Well, that's a great segue into, give us a little idea about something people might not know about Kayla.
A lot of people probably don't know that I'm sort of a nerd with classic horror movies, and I have this collection of like these figures. So I have actually a replica of like a Freddy Krueger glove from one of the movies. So I collect things like that. I have a little shelf unit in my bedroom, which is weird, but I have, you know, all these like Michael Myers and all these figures, and I love those old school, even like the gory House of a Thousand Corpses, those types of movies. So that's probably something that people wouldn't expect.
Wow, very cool. You look forward to Halloween every year.
I do.
Yeah, it's been a while since there's been any great movies out, the new horror movies though. So hopefully we'll start to see some good ones soon. Well, I tell you what, Kayla, thank you for everything you've done for the organization. Thank you you had enough going on with 17 people rolling up to you, yet you still stood up and said, look, I'm going to volunteer. I'm going to train these guys. I'm going to help bring them up to speed. And I know there's people other than you involved in that as well, but thank you for being the point woman on that. And we really appreciate it. So again, congratulations on being the Coronis Featured Employee of the Month. And thank you for being a part of our team.
Thanks. I appreciate it.